Okay, can you tell me where the pain is located?
Like right here, top of the foot.
This is right here. Okay.
Yeah.
Can you describe the pain to me?
It's kind of like a dull or constant pain.
Okay. Does it travel up along your leg, down to your toes? No. Okay. If you were to rate the pain out of 10, 1 being no symptoms, 10 being the worst.
7.
7. Okay. So what we'll do is we're going to do some active range of motion to determine what kind of injury it is and see if you have any deficits from both feet. Okay. So what we're going to do is we're going to do plantar flexion and dorsiflexion, and that will be along the sagittal plane and frontal axis, and then eversion and inversion will be a frontal plane and sagittal axis. Okay. Normal ranges of motion usually for plantar flexion would be 50 degrees, dorsiflexion would be 20, and then eversion is 5 degrees and inversion is 20 degrees. Okay, let's take a look. Let's point your toes towards your nose. Okay, it seems to be some deficit on your affected side here. Any pain there?
Yeah.
Yeah, there'll be pain there. Okay. Point your toes to the ground. Any pain there?
Just that 7. No increase like the dorsiflexion.
Okay. So then your range of motion looks like it's pretty even. For plantar flexion, you need to evert. So put your soles together. Any pain there?
Just the constant.
Okay.
No increase.
The range of motion doesn't seem to be affected. And then eversion, so put your soles outside your body. So it looks like your eversion on your affected side has been decreased and is affected. This one looks like it's about 5 degrees, and this one barely moves to neutral. Okay, so let's test, get some objective findings for your plantar and dorsiflexion. We know that your eversion is quite affected and limited on the injured side. So let's measure plantar and dorsiflexion. Let's use your fibular head, your lateral malleolus, and some anatomical landmarks, and also the head of your fifth metatarsal. So just rest your foot into kind of what's comfortable for you. Okay, so you're currently at 115 degrees. Let's point your toes towards your nose. Okay, so you have about 15 degrees of dorsiflexion, which is probably around normal. Normal is about 20 degrees. And let's point your toes towards me or the ground. And now it's 160, so you have 45 degrees, which is within the 50, which is normal. Let's test your affected side. Okay, same thing again. Let's use your lateral malleolus, fibular head right here as your landmarks, and the head of the fifth metatarsal. Okay, can you rest to whatever's comfortable for you? I know it's painful with dorsiflexion. Okay, so your normal is at 125. Can you dorsiflex? Point your toes towards you. Okay, so it moves like 1-2 degrees, so that's quite effective. Okay, let's point your toes to the ground. Okay, so we're currently at 150, so which is about 30 degrees for plantar flexion, which is about 70-75% of normal. But that's probably your normal. It's about the similar for both sides. So based on the limited range of motion of dorsiflexion and limited range of eversion, my indices of suspicion would be a high ankle sprain or syndesmosis, just because your pain is more on the dorsal side, and there is no pain around, the lateral malleolus. Okay, so if it was an inversion sprain, you would feel, or an ETFL sprain, or you would feel more, there'd be swelling around the lateral malleolus. If it was a ETFL avulsion fracture, there would be crepitus between your fibula or your talus as well. So, and it could also be a fibular fracture, but currently your pain is more so on the dorsal surface and not on the lateral surface, and doesn't travel up along your lateral side of your leg. And we would see some deformity or crepitus if it was an actual fibular fracture.